more than any other year. We need to completely defund Planned Parenthood and begin a process to end the tax-exempt status of this now profit-seeking, political-seeking organization, and I yield back.
For what purpose does the gentlewoman from California, who's a member of the committee, rise?
Okay, Madam Chair, I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
I rise in opposition to the Pence Amendment and the war on women throughout this bill. And to the gentleman from Indiana, just take a look at what's being proposed and why I call it a war on women. First, the elimination of funding for life-saving family planning programs funded by Title X, which help provide a range of critical services, including testing for sexually transmitted infections, contraceptives, and annual health exams, and which, by the way, do not include abortion services, though I wish that law were overturned. This war on women totally eliminates the President's Teen Pregnancy Prevention Initiative, which supports evidence-based sex education and are specifically designed to reduce abortions. It imposes a funding restriction on how the District of Columbia can use its own funds to pay for health care and abortion services. It includes an amendment to restrict state Medicaid funding for family planning, which are predominantly women of color in many communities. This is really a shame and disgrace. This includes an amendment to reinstate the federal refusal rule issued in the waning days of the Bush administration, which would dramatically expand the current ability of health providers to refuse to provide health care services that they oppose ideologically, which jeopardize the ability of patients to get health care. And that's just on the domestic front. The bill eliminates funding for the United Nations Population Fund, which provides critical reproductive health care, including family planning services to the world's poorest women, and which does not provide abortion services, though they are much needed. This bill also reinstates the global gag rule and prevents family planning organizations that provide abortions with their own private money from receiving federal funds. This bill cuts $100 million from USAID family planning program, but that's not enough for some people, as an amendment was filed to completely, mind you, completely eliminate these programs, which help prevent more than 7.8 million unintended pregnancies around the world. These decisions by the Republican majority will endanger women's health, severely restrict women's rights, insert the government into the private medical decisions of women and their families, and are nothing short but an all-out war against women, and we are fighting back. Instead of working together to get our economy moving again, to help the unemployed and to create jobs, Republicans are seeking to impose an ideological agenda on the country. And now we have the Pence Amendment, an amendment that would restrict Title X funding from going to Planned Parenthood, one of the oldest, most important, most trusted, most utilized public health organization in the country. Let's be clear, this is not about abortion. Existing restrictions prevent federal funding for abortion. This is about a direct attack on an organization that provides critical health services aimed largely at women in underserved communities throughout the country. With over 85 local affiliates and more than 800 health centers across the country, the services provided by Planned Parenthood are invaluable. Every year, Planned Parenthood affiliates see nearly 3 million patients and provide contraception to nearly 2.5 million patients and over 1.1 million pregnancy tests. They identify nearly 1 million, provide nearly 1 million Pap tests, identifying about 93,000 women at risk of cervical cancer. They provide 830,000 breast exams, nearly 4 million tests for sexually transmitted infections, including HIV. They provide health education for nearly 1.2 million people. How are any of these activities objectionable? Are you against women getting breast exams? Do you object to women and girls getting tested for HIV? Are you opposed to women controlling their own bodies and determining if and when they want to get pregnant? Let's be clear. Government funding does not make up the whole sum of family planning and Planned Parenthood's finances, but government funding does provide invaluable source to help local health centers provide services for women to avoid cancer, to protect their health, and to lead healthy and fulfilling lives. So let's stop this attack on a trusted health provider, and let's stop this war on women. That's not what the American people want. They want jobs. They want a chance to work hard and take care of their families. They don't want to argue with their insurance provider or with their employer or their government or their elected officials about abortions. We should be working together to unite our country and to tackle the challenges that Americans face each and every day, and not pursuing divisive, ideologically driven agenda. So I urge a no vote on this CR and on all these amendments that wage war on women.
What purpose does the gentleman from Pennsylvania rise?
I move to strike the last word.
The gentleman is recognized for 5 minutes.
Thank you, Madam Speaker. Madam Speaker, we have seen in just the past couple of weeks incidents that remind us of the horrors associated with the abortion industry. We've seen in a women's health clinic in West Philadelphia women and children brutally killed in late-term abortions. We've seen a series of videos that have given us a behind-the-scenes look at the standard operating procedures at Planned Parenthood clinics across the country. The videos depict investigative journalists receiving advice on how to run their prostitution business and how to obtain illegal abortions. Some people have said character is who you are when no one is watching. Or to put it another way, it is what you do when you think no one is watching. Planned Parenthood, the #1 abortion provider in the country, has revealed its true character in these videos. Unfortunately, Planned Parenthood staff exposed their true colors, and they neglected to act with integrity when faced with a situation dealing with sex trafficking. It was more important to them to promote abortion than to help rescue underage girls enslaved in prostitution. In this country, 95% of abortions occur in clinics, not hospitals. These clinics don't need federal tax dollars to support their unethical practices. Planned Parenthood recently reported providing 332,278 abortions in year 2009. That's the last reported year. Planned Parenthood itself has recently made plain the centrality of abortion to its mission, mandating that every Planned Parenthood affiliate have at least one clinic performing abortion within the next 2 years. Despite being a billion-dollar-a-year corporation, Planned Parenthood receives $363.2 million, 33% of its income, from government grants and contracts, that is, from taxpayer dollars. Unfortunately, Planned Parenthood actively ignores statutory rape reporting laws and campaigns against efforts to enforce or strengthen them, as illustrated in the recent videos. Planned Parenthood in Kansas claims to be, quote, a trusted source of health care and education for thousands of women, men, and children, end quote, yet was charged with 107 criminal counts, including failure to report sexual abuse and falsifying documents in order to perform illegal late-term abortions. Planned Parenthood in California has privately admitted to overcharging the state and federal governments by at least $180 million for birth control pills, despite internal and external warnings that its billing practices were improper. Planned Parenthood in Indiana has been accused of endangering the safety and well-being of minor girls by intentionally circumventing state parental involvement laws and breaking state law by refusing to report statutory rape. There are many other sources of family planning money to other organizations and to state and local governments. Unfortunately, Planned Parenthood is exploiting women and children. They've shown themselves to be an extreme organization with unethical practices. Our daughters and granddaughters deserve better. I urge support of the Pence Amendment, and I yield back the balance of my time.
The gentleman yields back. For what purpose does the gentlewoman from Illinois rise?
To strike the last word.
Gentlewoman is recognized for 5 minutes.
Madam Chairman, House Republicans have made their agenda really clear. What's obvious is that it's really not about creating jobs, it's not about addressing the economy, but rather the extreme agenda is to undermine women's access to reproductive health care and attack women's health providers that women rely on in their communities. We've seen an all-out assault on Planned Parenthood. Instead of attacking unemployment, Republicans are waging a war against women. This is not about federal funding of abortion, and it is not about quality of care. This is about cutting off women's access to affordable care in an effort to score political points. This amendment does nothing to improve the economy. It will result in lost jobs, and it will take away the only source of primary and preventive care from millions of American women. Planned Parenthood, a trusted organization by women, plays a critical role in our nation's health care system, and the Pence Amendment would have a devastating impact on communities across the country. Planned Parenthood serves over 3 million Americans every year. More than 90% of the care Planned Parenthood Health Centers offers is preventive care. Planned Parenthood provides life-saving cancer screenings, routine gynecological examinations, contraceptive services, immunizations, and testing and treatment for sexually transmitted infections. Planned Parenthood saves money. So this is not about saving federal dollars. It saves money. For every dollar spent on the services I mentioned and others, $3 are saved. 1 in 5 American women has received care from a Planned Parenthood health center at some point in her life, making it one of the largest women's health care providers in the country. And now is not the time to constrict women's access to and funding for Planned Parenthood, and American women will suffer if the extreme Republican agenda becomes law. 6 in 10 women who access care from women's health centers, like Planned Parenthood's health centers, consider it to be their main source of health care. This amendment intends to literally wipe Planned Parenthood off the map. Planned Parenthood is an invaluable community-based provider and is critical to achieving the goals of improving quality health care in this country, including efforts to improve women's health, lower the rate of unintended pregnancies, and decrease infant mortality. You know, I find it ironic, very disturbing, that the very same people that want to take away family planning funding and access to safe and legal abortions, which are not funded by public dollars, have also proposed a nearly $750 million cut to the Women, Infant, and Children program to pregnant women and newborn children. This, like the repeal of health care reform, is part of the Republicans' divisive social agenda that goes too far. Now is the time to be working on the issues that are most important to Americans, creating jobs and improving the economy, rather than legislation that takes health care away from women. And I'll yield back.
Gentlewoman yields back. For what purpose does the gentleman from Arizona rise?
I move to strike the last word.
Gentleman is recognized for 5 minutes.
Madam Chairman, I want to thank the gentleman from Indiana for bringing this amendment forward. It was said earlier in this discussion that this is a war being waged by one congressman on one organization. I don't think that that's accurate. I think that this is an effort by many members of Congress, each of whom represent some 650,000 individuals who do not want to see their tax dollars used to fund abortion. I think it's as simple as that. And when you see the videos that have been referenced earlier today about what went on in these clinics and the misrepresentation that was there and the out-and-out illegal behavior that was encouraged, that warrants some kind of action. And I think that's what this effort is about. So I think it behooves us to tone down the rhetoric and to actually decide what is this effort about. And it's about ensuring that individuals who do not want their tax dollars used to fund abortions may have that right to say so here on the House of Representatives, on the floor here, and to vote, to have their members of Congress, their representatives here, vote in the way that they feel they should vote. That's what this effort's about. I commend the gentleman for bringing it forward. I yield back the balance of my time.
Gentleman yields back. For what purpose does the gentlewoman from Florida rise?
Madam Chair, I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
Madam Chair, sadly, our colleagues on the other side of the aisle have no idea how to create jobs or turn the economy around, so their true colors have come to the surface. And Speaker Boehner made that clear when asked about potential job losses that will result from horrendous budget cuts that we have been debating for the last couple of days, when he responded, "So be it." So I rise today to urge my colleagues to vote no on this amendment. This is a dangerously ideologically motivated stunt that will imperil the lives and well-being of millions of women and their families. This amendment is not just a war on Planned Parenthood, as the gentleman from Indiana said. It's a war on women. Planned Parenthood clinics are a crucial part of our national health care fabric. Through federal funds, including Medicaid reimbursements and Title X funding on an annual basis, Planned Parenthood health centers are able to offer nearly 1 million life-saving screenings for cervical cancer, 830,000 breast exams, contraception to nearly 2.5 million patients, nearly 4 million tests and treatments for sexually transmitted infections, including HIV. Madam Chair, the House is not in order.
Pardon? Excuse me.
The House is not in order.
The gentlewoman is correct. House be in order. The gentlewoman needs to be heard, deserves to be heard.
Thank you. Nearly 4 million tests and treatments for sexually transmitted infections, including HIV, and education programs for 1.2 million individuals. These are much-needed services that we cannot afford to lose. In addition to completely defunding Planned Parenthood, this amendment would also strike all federal funding for Title X programs. This would be a colossal mistake and truly a matter of life and death to millions of women nationwide. Since 1970, the Title X family planning program has been a key component of our nation's health care infrastructure and an essential element in the winning strategy to reduce unintended pregnancies. Today, Title X serves over 5 million low-income individuals every year. In every state, women and men rely on Title X for basic primary and preventative health care, including annual exams, life-saving cancer screenings, contraception, and testing and treatment for sexually transmitted diseases. In fact, in 2009 alone, Title X providers performed 2.2 million Pap tests, 2.3 million breast exams, and over 6 million tests for sexually transmitted diseases, including nearly 1 million HIV tests. As a breast cancer survivor whose cancer was caught at the earliest stage, like my friend from Connecticut, I know how critical these screenings are in saving women's lives. And preventative care isn't limited to cancer screenings and education on how to avoid STDs. Supporters of this bill mistakenly argue that this cut is necessary to prevent federal funding for abortion. Let me be clear. Federal funding for abortions is already prohibited by law. This has been the case for decades. Yet this amendment attempts to take funding prohibitions to an unconscionable new level, and its pass will result in millions of women not being able to obtain necessary preventive care like birth control and cancer screenings. If Republicans truly want to reduce abortions in this country, they would vote against this amendment. Indeed, Title X actually reduces the number of abortions. Title X services help to prevent nearly 1 million unintended pregnancies each year, almost half of which would otherwise end in abortion. Current statistics from the Guttmacher Institute indicate that nearly half of pregnancies in the United States are unintended. We should be providing women and their families with the resources they need, not striking them. Indeed, Planned Parenthood and the Title X program provide vital family planning services which help improve the life of the mother and the child. It's a simple fact. Family planning keeps women and children healthy. When women plan their pregnancies, they are more likely to seek prenatal care, improving their own health and the health of their children. In fact, access to family planning is directly linked to declines in maternal and infant mortality rates. There should be no shadow of a doubt that this amendment is anti-woman and anti-family. While my colleague from Indiana may frame this amendment in the context of fiscal responsibility, that is once again a mistaken premise. This amendment would not cut the deficit. In fact, Title X actually saves taxpayer dollars. Since many of the patients served by Title X are on Medicaid, preventative care like cancer screenings and contraceptive counseling actually means fewer costs to the taxpayer in the long run. Indeed, for every public dollar invested in family planning, $3.74 is saved in Medicaid-related costs. That's savings to both federal and state governments. And one of the most detrimental, dangerous things we could do to women and their families right now is to defund the leading Title X provider nationwide, Planned Parenthood. Every year, Planned Parenthood works tirelessly to improve the health of communities across this country. 6 in 10 women who access care from centers like Planned Parenthood say it is their main source of health care. We cannot cut these women off from the health services that should be available to all of them. Efforts to undermine the Title X program and this essential health care provider are not only reckless, they are also anti-woman, anti-child, and anti-taxpayer. The ideologically motivated attacks we've seen on Title X's preventative care and Planned Parenthood. Thank you, Madam Chair. This is a horrendous amendment that would devastate access to health care to millions of American women, and it should be defeated. I yield back the balance of my time.
What purpose does the gentlewoman from Missouri rise?
Madam Chairman, I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
Thank you. I'd like to rise in support of this amendment. Planned Parenthood has funded abortion from the taxpayer for too long. It's been said that this is a threat to women's health. Well, Planned Parenthood isn't about health, it's about profit. They have a record of preferring abortion over the truth. I've seen firsthand their view of truth. Several years ago, I was a teacher and I taught child development. I had a student who came to me who just found out that she was pregnant. The night before, she had visited Planned Parenthood clinic to discuss her options. She was 4 weeks along. She asked a simple question: what does it look like? The answer: oh, don't worry about it, it's just a blob of tissue. They encouraged her to have an abortion, but thankfully she wanted more information. She and a friend came to me for information. They wanted to know if I had pictures of what a fetus looked like at 4 weeks old, since I taught child development. I did. She looked at the pictures of the baby with its developing fingers and eyes and beating heart. Her response: she was shocked. That's not a blob of tissue, that's a baby. And then she asked this question: why would they tell me that, Mrs. Hartzler? Sadly, I didn't have an answer. They didn't care about the truth. They didn't care about the young woman before them. They cared about a profit. This pattern continues with recent revelations that they were willing to cover up child sexual trafficking and child sexual abuse and aid and abet prostitution. Where was Planned Parenthood when they had a chance to protect young women? They turned a blind eye. I'd call it a war against young women. And yet this organization receives $363 million of revenue a year from you and I, the taxpayer. Hardworking men and women in this country should not have to write a check on April 15th to fund these abominable practices. In a time when we are borrowing 40 cents out of every dollar we spend and running a huge deficit, we need to look for savings to the taxpayer wherever we can. Certainly, saving $363 million from this abortion provider is a smart and it's a right thing to do. For generations now and so that all Americans, born and unborn, will have the opportunity to enjoy the blessings and the rights of life, liberty, and the pursuit of happiness. So as a woman and a mother and a former teacher, I'm proud to support the Pence Amendment and ask all my colleagues to stand on the side of truth, life, and the young women of this country. Madam Chairman, I yield back.
The woman yields back. For what purpose does the gentlewoman from California rise?
Madam Chair, I rise to strike the last word.
The gentlewoman is recognized for 5 minutes.
I rise this evening to speak in strong opposition to the Pence Amendment. The Pence Amendment is an attack on women's health. This much is clear. What isn't clear is what these women who today are cared for by Planned Parenthood doctors and nurses would do for care if the Pence Amendment should pass. Planned Parenthood serves 3 million Americans every year. These are Americans who rely upon Planned Parenthood to receive their annual wellness exams, Americans who rely upon Planned Parenthood to receive contraceptive services to prevent unplanned pregnancies, Americans who get tested and treated for sexually transmitted infections, improving their health, and protecting the health of their communities. Americans who rely on Planned Parenthood for their cancer screenings, tests that can detect cervical cancer or breast cancer early, when it is easier and less expensive to treat, saving our entire health care infrastructure millions of health care dollars. And these Americans cannot just go somewhere else, somewhere that my colleague on the other side of the aisle would find more palatable. 60% of those who use Planned Parenthood services consider it to be their main source of health care, their medical home. A vote to strip Planned Parenthood of its funding is a vote to cut these Americans off from the health care system. Surely we can't want that. In my own congressional district, Planned Parenthood of Santa Barbara, Ventura, and San Luis Obispo counties serve over 31,000 patients every year. I must ask the supporters of this mean-spirited amendment, where should these 31,000 people go? Especially now when this reckless Republican omnibus spending package cuts community health centers by $1 billion. And what about your constituents? In the amendment's author's own state of Indiana, 18,000 citizens rely upon Planned Parenthood services each year. 18,000 Hoosiers whose elected representatives are voting to shut down their doctor's office. Finally, Madam Chair, I know that the supporters of this amendment are trying to characterize this as a vote about abortion. It's not about abortion. It's a vote about whether or not you believe in providing women and Americans comprehensive health care. Because, despite all the misinformation being thrown around here, 95% of Planned Parenthood services have nothing to do with abortion. And as has been strongly and firmly stated, there are no federal dollars used for those receiving abortion services. Last time I checked, 97% is an A+, which calls into real question the motivation behind this amendment. Combined with the mean-spirited bills moving through the Energy and Commerce and Judiciary Committees attacking women's health service access, with the zeroing out of Title X family planning funds in this bill, with a reinstatement of the global gag rule, with a 50% slash in international family planning money, and completely devastating slash to the Women's, Infants, and Children's Nutrition Service.
This is not in order. The gentlewoman deserves to be heard.
Thank you, Madam
All
Chair.
members take their conversations from the floor. Gentlewoman may proceed.
As I was saying, this Republican majority is instituting a completely devastating slash to the Women's, Infants, and Children's Nutrition Program, along with the other cuts I've mentioned. It adds up to only one conclusion. House Republican leadership is starting an all-out war on women's health care. The targets: women's insurance coverage, their providers, their health care choices. For more than 90 years, Planned Parenthood's doctors, nurses, and other health professionals have been providing health care to millions of women. And 1 in 4 American women voters has received care from a Planned Parenthood health center at some point in her life. So let's take a stand against this attack on women's health care. I urge a no vote on the Pence Amendment, and I yield back the balance.
Gentlewoman yields back. For what purpose does the gentleman from Illinois rise?
To strike the last word.
Gentleman's recognized for 5 minutes.
Madam Chairwoman, I rise today in opposition of the amendment. The elimination of family planning dollars would deny access to preventative care for millions of women each year. From the numerous conversations I've had with doctors, including my own sister, who's an OBGYN, I believe in the importance of encouraging access to basic preventative care. Since 1970, the Title X Family Planning Program has been a component of our nation's health care infrastructure and has been an essential element in providing contraception and education to millions of Americans. Today, Title X Family Planning services over 5 million low-income individuals each and every year. Through a recent study, we learned that for every dollar invested in family planning, approximately $3.74 is saved in Medicaid-related cost. Title X funding provides critical preventative health care, including annual exams, cancer screenings, HIV testing, and family planning. While we must always ensure that funds are applied properly, completely prohibiting any funds from going to the main provider of Title X family planning services, I believe, would be short-sighted and would negatively impact the lives of women who depend on these health care services. I yield back.
Gentleman yields back. For what purpose does the gentleman from New York rise?
Madam Chairman, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Thank you, Madam Chairman. I'm not going to repeat I'm not going to repeat all of what has been said about the Republican war on women, about the fact that the Republican majority was elected pledging jobs, and all we see is a war on various social services and women and nothing about jobs. But I am going to say this. I've been listening very carefully to the supporters of this amendment, to Mr. Pence and others. And what do I hear? I hear that we must punish Planned Parenthood by defunding them because they have committed a number of sins. Sin number one, they perform abortions. They're a very large abortion provider. And even though none of those abortions are paid for with federal funds, that's prohibited under the Hyde Amendment, however you read it, we don't like Planned Parenthood because they're a large abortion provider. Number two, we don't like Planned Parenthood because they've committed allegedly various terrible things. Some provocateurs went into their offices and said that they were representing sex workers, and they were offered services, and any organization that's willing to do this should not get federal funds. We are going to punish Planned Parenthood, number one, because they're a large abortion provider, and we don't like abortion providers. Number two, because they do other things which, if in fact they do, which I don't think they do, but if in fact they do, are bad things. There's a major problem with this. It's a major problem with this rhetoric and with this reasoning. And by the way, the CR, of which this is an amendment, to which this is an amendment, eliminates Title X family planning funding anyway. So it eliminates most of the funds, federal funds that go to Planned Parenthood. But whatever funds are available, they can go to other people to provide those services, not Planned Parenthood, because we don't like Planned Parenthood for various reasons. A bill that punishes someone, some person or organization who is named or easily identifiable by legislative action is called a bill of attainder. That's the definition of a bill of attainder. A legislative punishment directed, a legislative penalty, a legislative enacted penalty, in this case no funding, directed at some identifiable person or organization to punish them for something. Article 1, Section 9 says, no bill of attainder or ex post facto law shall be passed. Fundamental foundation constitutional law. If Planned Parenthood or anybody else is doing terrible things and ought to be punished, that's up to the courts. If indeed Planned Parenthood is trafficking with sex traffickers, let them be prosecuted. If indeed Planned Parenthood is doing anything illegal, let them be prosecuted. Let the organization be prosecuted. Let the individuals, employees who are doing these terrible things be prosecuted. That law. That's our system. But you don't punish an organization because they are doing something of which you don't approve. Now, if you want to say, we don't think that there ought to be any contraceptive services in the United States, and therefore we're going to have no Title X funding, the CR does says that. I don't agree with it, but it's constitutional. But to say that if we have Title X funding, if we have maternal services funding, none of it can go to Planned Parenthood, they can go to somebody else, but not Planned Parenthood, that's a legislatively enacted punishment because Planned Parenthood is, or is allegedly, doing things of which you don't approve. Now, I heard a lot at the beginning of this Congress about how we have to make sure that we adhere to the Constitution. This is a bill of attainder because it is a legislatively enacted punishment of a named organization because that organization is doing things or is allegedly doing things of which we don't approve. So I submit that in addition to all the other reasons why this shouldn't be done that have been enacted here, this is flatly unconstitutional, and I challenge anyone to say how this is not a bill of attainder. And again, the black letter definition of a bill of attainder is a legislatively enacted penalty aimed at someone, some person or organization that's identifiable, named right here, for some reason, that they've done various things, provided abortions, done illegal things or otherwise. So In addition to all its other problems, this amendment is unconstitutional and will be struck down by the courts if it should pass. I yield back.
The gentleman yields back. The committee will rise informally.
The House will be in order. The chair will receive a message. Go ahead.
Mr. Speaker, a message from the Senate.
Mr. Speaker,
Madam Secretary.
I have been directed by the Senate to inform the House that the Senate has agreed to H.Con. Res. 17, providing for a conditional adjournment of the House of Representatives and a conditional recess or adjournment of the Senate.
The chair lays before the House the following enrolled bill.
H.R. 514, an act to extend expiring provisions of the USA Patriot Improvement and Reauthorization Act of 2005 and Intelligence Reform and Terrorism Prevention Act of 2004 relating to access to business records, individual terrorists as agents of foreign powers, and roving wiretaps until December 8, 2011.
The committee will resume its sitting.
For what purpose does the gentleman from Indiana rise?
I move to strike the last word.
Gentleman is recognized for 5 minutes.
Thank you, Madam Chairman. I rise today in support of the Pence Amendment that prohibits any funds from the underlying bill going to Planned Parenthood of America. I want to start with a personal story. As a physician, I've performed life-saving surgery on infants as young as 22 weeks gestation at birth. Madam Chairman, I've held these lives in my own hands. They're viable human lives at birth, and unfortunately Planned Parenthood uses taxpayers' funds to cut these lives short, tragically sometimes within weeks of medically proven viability outside the womb. Again, I've held these lives in my hands. Abortion, of course, for any reason is wrong, but this situation I have personal experience with is particularly distressing for me because I'm a physician and also I'm a father of 4. I want to reiterate that Planned Parenthood has received $363.2 million in taxpayer funding as of its 2009 annual report, 1/3 of their $1 billion income. During that same time period, Planned Parenthood-supported clinics performed over 324,000 abortions, and this is by their own accounting. Federal taxpayers should not be asked to subsidize these actions. In addition, Madam Chairman, currently in Planned Parenthood, there are 11 clinics under investigation in Arizona, Ohio, Connecticut, California, Tennessee, among other states, including my own state of Indiana, where in 2008 a video showed a Planned Parenthood clinic covering up a rape of a 13-year-old girl. Can everyone see a pattern here? In total, Planned Parenthood is facing 107 criminal charges, including 23 felony charges. What they're doing is not only morally wrong, but appears to be criminally negligent. Press reports have recently said that Planned Parenthood is now mandating by 2013 that all of its regional affiliates must provide abortions. This is important to note that the amendment does not affect Title X services such as breast cancer screening, HIV prevention, STD testing, and other valuable health care services to women. This amendment is about abortion, in contrast to what's been said here on the House floor earlier tonight. Title X supports 4,500 community clinics throughout America that provides critical services, which I support, and I'm proud of these facilities for the quality of care that they provide. Again, this amendment is about abortion. I strongly support it. I urge all my colleagues to vote yes, and I would like to thank the gentleman from Indiana, Mr. Pence, for his strong leadership
on this amendment, and I yield back my time. Thank you.
Gentleman yields back. For what purpose is the gentleman from Vermont rise?
Strike the last word.
Gentleman is recognized for 5 minutes.
Madam Speaker, I am pro-choice, but that is a question of deep conscience, religious conviction, personal importance to every individual and every family. One of the conservatives who has served in this institution was Henry. The law of the land, since it was passed by Mr. Hyde, said that there shall not be public funds that are used to pay for abortions. That is true now. It has been true for decades since that law was passed, and it reflects a certain mutual respect that we can have differences of opinion even on matters of profound religious conviction, moral conviction, and moral belief. This is not about abortion. The Hyde Amendment is the law of the land. Federal funds cannot be used under this provision to provide abortions. What this is about is whether primary and preventive care is going to be extended oftentimes to poor people, but also to vulnerable middle-class people by Planned Parenthood clinics throughout this country, including 10 in Vermont that are doing a tremendous job for people who really need this care. Is this Congress big enough, generous enough, that it can allow those with different points of view on this question of choice to coexist as long as we have this separation with the Hyde Amendment? It has not been abolished. It is intact. So the question I ask is, if we pass this bill, what happens to the 19,000 Vermonters who get services for HIV testing, who get services for breast cancer screening, who get services for cervical cancer, who find out when it's timely to find out so they can be healthy and have a full life? What do we say to them when we pull the plug on them having access to the care that they need and they deserve? This is not necessary. This is not about abortion. The real-world implication of this legislation will be to say to 19,000 women in the state of Vermont, from one end of the state to the other, no, you cannot have access to cervical cancer screening. You can't have it to breast cancer. You can't get evidence-based sex education. We are a better nation than that. We are a better Congress than that. The Hyde Amendment acknowledges that we have profound differences of opinion on this question of abortion, but we can share a common goal, that young, vulnerable Americans in every one of our districts can have access to the care that they need. I yield back.
Gentleman yields back. For what purpose is the gentlewoman from North Carolina rise? Gentlewoman is recognized for 5 minutes.
Thank you, Madam Chair. I came tonight to support the Pence Amendment. I just came from my office where I was reading and answering my mail. My tax-paying constituents emphatically do not want their hard-earned money being used to kill innocent life. Planned Parenthood currently has 87 regional affiliates with 817 health clinics in the U.S., with 173 performing surgical abortions, and many others, at least 131, and as many as 300 offering chemical abortions. Planned Parenthood itself has recently made plain the centrality of abortion to its mission, mandating that every Planned Parenthood affiliate have at least one clinic performing abortions within the next 2 years. Planned Parenthood reports that it's a not-for-profit organization and receives over $336 million in combined federal, state, and local grants and contracts, and had an excess of revenue over expenses of almost $112 million in 2006, $85 million in 2007, and $106 million in 2008. The Planned Parenthood in California has privately admitted to overcharging the state and federal governments by at least $180 million for birth control pills, despite internal and external warnings that its billing practices were improper. My colleague from Indiana gave also a lot of statistics about what the problems are with Planned Parenthood. And despite it being a $1 billion-a-year corporation, Planned Parenthood received $363.2 million reported in its 08-09 annual report. 33% of that income from government grants and contracts, that is, from taxpayer dollars. Of that, $53 million is from Title X. So from these other government sources, they're getting $310 million. We are not going to be stopping Planned Parenthood from giving true health care to women and children. We know that the vast majority of Americans oppose abortion. Over 60% oppose any money coming from taxpayer receipts for abortions. My colleague from New York talked about this being a bill of attainder and said that this is a punishment. Well, ladies and gentlemen, I'm less concerned about the potential that this is a punishment for Planned Parenthood, but I'm very concerned about the punishment inflicted on millions of innocent lives when they are violently deprived of their lives through abortion in Planned Parenthood clinics. I yield back.
Gentlewoman yields back. For what purpose does the gentlewoman from New York rise?
Madam Speaker, I rise to move the requisite number of words.
Gentlewoman is recognized for 5 minutes.
And I thank you. I rise in strong opposition to this amendment that attacks Planned Parenthood. By targeting Planned Parenthood, the Pence Amendment will risk the lives and safety of millions of American women. These proposed cuts to family planning represent the opening salvo in an all-out war on women's health. And I have been a soldier on the other side of that war for several decades. I have served now in 3 legislatures. In 2 of them, this was one of the issues that came up continuously, is what we would do. In most cases, men in either blue or gray suits felt compelled and competent to tell women what they could do with their lives. It has been a serious problem to try to get women's health in the first place. It was up to the 1990s before women were even considered subjects for research at the NIH. It's been an absolute awful time for most of us who are such strong believers in the rights of women and women's health, and that women should have the ability to make decisions themselves and not have men have to make them for them. It's been a dreadful time for us to see ending tonight and trying to do away with one of the most important agencies in the United States, Planned Parenthood. And I stand here tonight in lieu of hundreds of women in the state of New York, most of them Republican women, who financed, who spoke for, who founded the agency of Planned Parenthood. New York was being filled with influx of new citizens to America, and Planned Parenthood allowed them to space their families, space the children so that there would be healthier children and healthier mothers, and we have all benefited from that. But why are we attacking proven medical care? Why aren't we trying to create jobs, which is the only thing that we've heard for the last 6 months? This amendment will do absolutely nothing to move our country forward, but indeed backward. In my home state of New York, the cuts to Planned Parenthood would impact 209,410 patients. Don't tell me that what you're doing here tonight is to allow Planned Parenthood to keep on with the cancer screenings, to keep on with making sure that their cervical cancer is not something about to take the life of a woman. Don't tell me that's what you're doing, that you're only trying to cut abortion. You know, we know, everybody knows that Planned Parenthood abortion money is not public tax money. And as my other colleagues have said, that has been true for a very long time. The cuts were proposed under the guise of being fiscally responsible, but nothing could be further from the truth. For every dollar, and I want to say this maybe twice, it is so important, because nobody seems to have gotten this except my new friend from Illinois. For every dollar invested in family planning services, taxpayers save $4. So if you think you're going to save yourself some money, go back to your planning board for that. But cutting family planning is not fiscally responsible, will not reduce the United States bottom line. Furthermore, as we've said again, over and over again, it has nothing in the world to do with cutting federal money for abortions. That is simply a smokescreen. But we want to empower women to be able to prevent unintended pregnancies. And if that's what we like to do here tonight, with the help of Planned Parenthood and other agencies and many doctors and medical professionals in the country, make sure that women have education and access to contraception. That is precisely what family planning is and what it does. And I yield back the balance of my time.
Gentlewoman yields back. For what purpose does the gentleman from Indiana rise?
Thank you, Madam Chairman. I move to strike the last word.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I rise in support of the Pence Amendment. The time has come to end federal funding of abortion. This is one of the worst misappropriations of funds in our federal budget, and it is unacceptable to most of the people, Republican, Democrat, liberal, or conservative, in this country. Many taxpayers, including me, are sickened that the hard-earned tax dollars are put toward funding the nearly 1.3 million abortions in America every year. The minority party's demagoguery and demagoguing language about some kind of war on women is nothing but laughable. Plenty of family planning services outside of Planned Parenthood exist to help families seeking direction, care, and counsel. Those ethically sound places and services deserve a portion of funds to continue their much-needed and well-respected services. But our nation's largest provider of abortions isn't one of them. Under Title X, Title X, federal funds go directly to Planned Parenthood, where the money ultimately funds abortion, and this is one of the worst stipulations in current law. Again and again, Planned Parenthood has proven itself corrupt and misleading. No American who is against abortion should be required to help pay for it, and no American can seriously argue that the federal government isn't paying for abortion right now when Planned Parenthood receives at least $360 million from the taxpayers each year, while simultaneously performing more than 324,000 abortions. Regarding the gentleman from New York's charge that we should be using a bill of attainder and challenging us to say otherwise, I take that challenge. As a person licensed to practice law in Indiana and licensed to practice before the United States Supreme Court.
The House is not in order. Will members take their conversations away from the floor? The gentleman deserves to be heard. Gentleman may resume.
Thank you, Madam Chairman. I would say that the bill of attainder, this amendment is not that. The people of the 4th District of the state of Indiana and their representative have the right to produce an amendment to stop taxpayer funding of abortions, and we are doing that here tonight. Thank you very much.
For what purpose does the gentleman from California rise?
I rise to strike the last word.
The gentleman is recognized for 5 minutes.
A number of our colleagues on the other side of the aisle, the Republican side of the aisle, have said that they don't want abortion to be funded, and therefore they're going to vote for the Pence Amendment. But they believe that people ought to be able to get the clinical and preventive services that a group like Planned Parenthood would otherwise make available to them. Well, look, Planned Parenthood does not pay for anybody's abortion using taxpayers' dollars. That is clearly in the law. It's covered by the Hyde Amendment. If Planned Parenthood has abortion services, it is completely separate. It is not only separate from the family planning services and others for which they get government funding, they have to keep separate records. It's completely a different operation. So the Pence Amendment is trying to strike the funds under the Health and Human Services programs for the services that Planned Parenthood as an organization would provide for them. Now, it's not just family planning funds. It's all federal programs, including Medicaid and the Community Health Centers program. Now, this organization serves 15% of all women in need of contraceptive services in the U.S., and 4 million women, for 4 millions of women, it is their primary health care provider, the place they go to, not only for planning services, but basic preventive health services such as cancer screenings. Take that money away from them, they're not going to be able to serve the women who need those services. So where will those people go? Are they going to go to the community health centers? Well, this particular funding bill takes out $1 billion from the community health centers. Well, where else can they go? Are they going to look to the Medicaid program? Well, one of the entitlements that the Republicans most want to savage is Medicaid. Well, then where can they go? Are they going to go to the exchange in a couple of years that will be available under the Affordable Care Act? Well, of course not. The Republicans are trying to repeal that law. What will be the consequences? The consequences will not diminish the number of abortions. The consequences will be to deny women and men who may go to a clinic or to Planned Parenthood in order to get basic medical services. I think this is a serious mistake. If you're against abortion, be against abortion, but don't take it out on Planned Parenthood, because they serve abortion clients in a separate operation. That's like saying, I never want to pay for any services provided by a doctor, even though it's not abortion services. I don't want that doctor to get any money for contraceptive services. I don't want that doctor to be paid if he's providing screening for venereal disease. I don't want that doctor to be paid for any other service, because he might also, without your funds being used, provide abortion services. When you look at this carefully, this is trying to punish Planned Parenthood, but the ones who get punished are the people who won't be able to get the family planning services and the preventive screening services that Planned Parenthood regularly provides. And they won't be the provider, the only provider for many of these women, because they have nowhere else to go if they can't afford to go see a private doctor and pay for it. I thought it was amazing to hear an argument that was made on the House floor that one member didn't like money to go to Planned Parenthood because they're competing with for-profit abortion services. I just was stunned by that argument. I didn't know what it meant, except perhaps they'd like to have the private for-profit abortion services be able to provide the services instead of Planned Parenthood. Well, whatever happens there is another issue, because federal dollars, taxpayers' money, will not be used for it. But taxpayers' dollars should be used for Title X family planning, for Medicaid, for community health centers, for health screening, for preventive health services, and that's why the Pence Amendment should be defeated.
Gentleman yields back. For what purpose does the gentleman from Texas rise?
Madam Speaker, I move to strike the last word.
Gentleman is recognized for 5 minutes.
Madam Speaker, I rise today to support the Pence Amendment, which would prohibit any federal funding from going to Planned Parenthood. I want to thank my friend from Indiana, who continues to fight tirelessly to ensure that organizations that promote and perform abortions do not receive federal funding from hard-working taxpayers in this country, the majority of whom do not want their money going to such causes. In June, I received a report I had requested from the Government Accountability Office, which revealed that just 6 organizations connected to the abortion agenda received over $1 billion in federal funds over the past 8 years. $1 billion. The most significant portion of that money was for Planned Parenthood and their affiliates, the largest abortion provider in the United States. A recent Planned Parenthood reporting shows that in 2007 alone, 305,000 abortions were performed at their facilities. Planned Parenthood recently opened a new facility in Houston, right in the middle of Houston's largest minority neighborhoods. At 7 stories high, in 78,000 square feet. This center is their largest center in the United States. An entire floor is going to be completely devoted to abortions. If we keep sending federal funds to abortion providers, we are supporting abortion advocates everywhere with our taxpayer dollars and allowing them to build more mega centers such as the one in my hometown. It's time to renew this call and bring light to this issue. The transfer of taxpayer funds to support such organizations must stop. I'm proud to have once again introduced the Taxpayer Conscience Protection Act, a bill that requires each state to report annually to the HHS Secretary the amount of funding which is sent to organizations like Planned Parenthood. And before I conclude my remarks, I have to point out to my colleagues on the other side of the aisle that the Pence Amendment does not cut any funding for health services. It simply blocks those funds from Planned Parenthood, the largest abortion provider in the country. There are many health clinics, hospitals, faith-based organizations, and many more that also provide health services for women. We must shine a bright light on the exorbitant amounts of money that taxpayers provide each year for abortions. I ask my colleagues to stand beside our colleague from Indiana in this fight by voting a resounding yes on his amendment. I yield back the balance of my time.
Gentleman yields back. For what purpose does the gentleman from Florida rise?